stay moving and active longer. All right, with that being said, let's get into it with Dr. Tad. Dr. Tad, we haven't known each other long, but I gotta tell you, our brief moments together, man, you're constantly swarmed by people. I mean, it is like people are swarming to you for questions, insight, and what's going on around Regen. Tell us, what are you seeing out there when it comes to how people are leveraging biologics and other tools like Shockwave to help kind of get themselves better, man?
Yeah, well, that's the great thing now is there is a lot of excitement. You know, I've been in this industry for 15 years, and it's really growing. The evidence is catching up with it. So a lot of energy-based medicine has been added to what we had previously been doing with PRP, with bone marrow, with adipose, and we're getting better results, you know, quicker response when we combine the energy medicine with the regenerative medicine. So that's hugely exciting, and that's why there's so many people around all the time, because it's not just the PRP guys anymore. It's the diagnosis guys, the energy-based medicine that is all kind of collaborating together, which is really exciting.
Dude, no, it is, man. If we can go catch some shade over here, it's a little awning. But what are you seeing like in practice when you talk about combining energy and some of the biologics as well, man?
So yeah, recently, over the last 5 years, multiple papers have come out showing doing PRP by itself or when combining with the Shockwave treatment, in particular the focus Shockwave, where we're getting a better response, and that combination, that symbiotic relationship where the benefits from the biologic combined with the benefits from the focus Shockwave, from the energy-based treatments, are producing a better result. And that's not just the outcome saying like pain scores, function, all that. We're actually seeing different biological processes going on with the energy-based medicine. So it's not just, oh, they're feeling better. We're actually seeing that live with the different chemical signals, growth factors, and transcription factors from the energy base. So they're actually causing a biologic reaction that's helping improve the patients, which is hugely exciting.
Now, obviously, I'm biased. I'm in the whole focus side. I'm in that whole category of doing the whole focus Shockwave now.
Yes.
And I mean, to me, of course, I love that. But from a patient standpoint, what's the time look like for them, difference-wise?
Yeah, well, that's the thing is most of the time patients have tried stuff, you know, I'm the second, third opinion. So a lot of them have tried physical therapy, have tried the conservative treatment, have tried medications. So this is kind of the next step, and they're like, this isn't working. But the other side of it too is we give a lot of patients, you know, the option saying, all right, we can boost this. I know we can get you back quicker, but obviously start physical therapy, try that, and then see the benefits from this. So it is a collaborative effort. So we're still doing all the traditional stuff, but showing the patients how we can get them back quicker, get them back stronger. And sometimes, a lot of times actually, with some of the athletes, we're using performance and enhancing methods. So not even an injury coming back, but we're boosting the training that they're doing so they can recover quicker, get back on the field quicker too. So
no, I think it's great. No, I think it's super cool. One of the things that we were at the NBA show last month in Chicago, and we were talking to lots of the trainers, and we started showing them the actual portable Shockwave, and they start thinking about doing this like pre-game. Do you have any thoughts about, when we talk about performance boosting wise?
Yes.
It wasn't, I mean, this could be good or bad too. I have no clue. So, I mean,
yes.
Give me your honest thoughts about how that will look for somebody.
Yeah, so there's really only been one study that kind of showed how athletes do over a week, and it was radial Shockwave and T, but a lot of similar concepts with the focus Shockwave, but treating the athletes actually daily during a 2-week professional basketball tournament.
Wow.
And what they showed is not only less injuries throughout those 2 weeks from the intervention versus the control, but it was basketball tournament. They scored more points, more rebounds. Right. So it was crazy that they didn't know what they were getting, but you can't lie with the stats in the tournament. But like of the group that got the intervention, they played better, they did better. So that is a huge thing where, no, we're not just recovering from injury. We're giving them the ability to actually enhance their performance.
Dude, that's insane. That's insane. I mean, I heard people doing this, like, but I didn't know there was a study where people were actually like, documented from that standpoint. It's cool because, like, in the actual equine world, they won't even let them do Shockwave pre-race. Because, and there's mixed thoughts here, but there's a performance boosting component to that, right?
Yeah.
And,
no, I wonder if there's any safety involved in that, but I also think that yes, it is a performance booster, performance enhancer, and guy does a lot of Shockwave over at England. Paul is basically saying, he's joking, but he's saying, I'm not going to stop pushing this until the IOC bans Shockwave, and I love his energy, I love his passion. But truly, I mean, yes, we had all the performance enhancing, scandals in the 90s, and I mean even earlier with steroids and whatnot in the 70s. But this is not a drug. This is not something that's coming that is harmful. This is something that is changing your biology, making you stronger, making you recover faster. So a true performance enhancer without any of the negative downsides that some of those drugs in the past have caused.
Dude, I think it's awesome. I think it's killer in a good way. But I got to ask you because I have you here for a second. The whole enhanced games.
Yes.
Right? I mean, what was your overall thoughts about it? I want to try to lead it. Like, what was your overall?
I love the kind of the science behind it and opening up the veil, and no one's hiding it, and there are safety measures, in place as far as that goes. So obviously the athletes are accepting that they're a guinea pig, but that there are risks involved.
Same experiments, yeah.
Yes, but as long as it's regulated and it's for this performance enhancing and it's not causing negative side effects now or down the road, I'm all for pushing the field, because a lot of my patients are athletes. They want the best of their bodies. Their salary, their livelihood depends on that. But then a lot of the patients just want the best of their body. They don't have to be athletes, but they're trying to live as healthy and long as they can. And musculoskeletal orthopedics is a huge part of that. So giving them every advantage we can give them is what's best for the health of the nation and each individual patient.
I mean, yeah, man. All right, so I'm glad to hear you say that. One, and I'm not surprised you said that, but two, like, I'll say this is something that I'm kind of pumped about. I like where this is going, the whole transparency behind it, people knowing what the protocols are. You get to you really kind of look underneath the hood and say, did it work? What's helping? And then tweaking it, right? Because I was actually glad to see them they actually doubled down on the actual bonuses for next year from what I saw. And so they've upped the ante. And I just think that's a good thing. Because stuff is happening, but why not know collectively what's going on versus somebody trying to go in their own silo and try to always figure it out, in their own.
Because the other option is, pushing them away into this little hole, and dark web, whatever you want to call it, and having them do it there and not be, regulated and not see what the numbers are and everything like that. So now that it's out in the open, we can have better safety, we can have better data saying, all right, this works. Probably don't want to try this, and really figure out what's best for the collective whole.
And I guess me being 42 and still having visions of myself trying to be athletic again, I mean, like, that component is damn cool too. And lots of the athletes that were older athletes, obviously, when you think about that piece, because I know you work with a ton of athletes from all ranges, if you had to give them a couple of different options, what's something that you would recommend someone that's trying to boost the performance side of their, they're in the upper end of their, career, let's call it?
So, I mean, two sides of it is, one side, if there's an issue that we need to address, that, or something that is breaking down that we're trying to prevent getting bad. So a lot of what we do with the biologics can address those. But as far as just performance enhancing, I really think the big trend is energy medicine, is some of these devices that are giving your body energy so you can recover. Our bodies are doing well in most areas recovering, but there are certain areas that don't heal as well as others, and we've recognized those, and those are the areas that kind of break down. So really boosting up those areas with the focus shockwave, even stuff like hyperbaric or some of the other things that are really helping systemically. The better the whole body is, the better the hip's going to be, the knee's going to be, the shoulder's going to be. So really addressing that whole body.
Dude, I'm just smiling because I'm thinking about your actual lab back in Florida, man. I mean, I think it's loaded. You got hyperbarics in there. I mean, you obviously got the trainers that like they know what the hell they're doing in there. And so, but that whole like a performance side seems that's the piece I don't think people have to touch that much when it comes to doing this. People are looking at, oh, you have injury, let's go address it, of course, and that's the start. But I think there's a whole other layer here of performance that we're not even.
Exactly.
It's still early days, let's call it.
And this are athletes, this are, that group population, but we're also looking at 50, 60, 70-year-olds that are trying to stave off that. I don't want to be inactive when I'm 70, 80, 90. So we're trying to build those guys up very strong when it's a little easier to.
Yep.
The younger, the better, but build those up strong. So when age kind of kicks in, we already have that buffer, so we're going to have a good outcome. Instead of falling off, we're going to try to maintain that as much as possible. But we got to be proactive. We cannot be reactive. That's when stuff piles up. Yep. So we got to be proactive, diagnose stuff, see what's going on, and see kind of into the future, so we don't end up where we don't want to be.
Well, we could pretty much get ready to wrap up and head back. But man, I gotta say that angle of working with like this elderly population that's trying to stop, they just want to stay active longer. I don't know how else to say it. That's just, I mean, if people are aging up, if you're investing in your health, like talk to the doctors that are thinking about getting into this space that you've been heavily ingrained in. Like, where should they be putting their energy? Like, I mean, obviously there's a lot of places they can go. They could put it towards, pain management. They could put it towards performance-based. Yes. They could put it towards trying to help out the aging population. How do you kind of get them to kind of think about what's best for the target?
Right. Well, number one, recognizing what is going on with the investment. So obviously, people have different salaries, different wealths, but seeing the importance of your own body, of your own health as your number one concern, because without your health, doesn't matter what your TV or your car or anything else like that looks like. So really having the patients understand the value of their health. If we can let you live healthier longer, then you'll be more active. Any investments you have are going to accrue more the longer, the healthier that you live. So really seeing any of these things, whether it's just going to physical therapists, where it's trying Shockwave, where it's PRP, whether it's bone marrow, any of these additions, not seeing it as okay, that's just to make my knee feel better, but really investing in the whole body and getting the patients to see that is the most important thing.
Yeah, it is. Do you think patients are getting it? Is that something that's still early? Or they
No, I think in the last couple of years, there's really been a kick of health across America. Obviously, in Miami, it's huge there, where everyone's active, trying to better themselves. So yes, a lot of people are seeing that there, but across the country, which a very good thing, that better than a Beanie Baby or whatever trend is out there. I'm loving that health longevity is the trend that's going on right now, and people are catching the bug. And there's a lot of good evidence. We still need more evidence, but we can really help people along that journey to be the healthiest they can be.
Oh, yeah. It's definitely better than Beanie Babies, bro. Definitely better than that. Well, Doc, man, as we wrap up, man, what's like next for you? Because, you got your hands on a couple cool things, but, what do you think's top priority for you right now?
Cannot say everything. Obviously, a lot in development, but really we're seeing more collaboration. Instead of fighting the other doctors in the area or across the country and trying to get every patient, we're really pooling our resources, trying to create a network where if I have a patient that's in LA, I know the best guy there. I know who I can send him. So having that collaboration, that trust is huge. So that's one component just amongst us doctors, but really adding the energy-based medicine to the biologics that we've studied so long, and seeing that impact and seeing that improvement is huge. And I've been told many times that this is a crazy statement, but I truly believe in the future, energy-based medicine is going to kind of take over a lot of the biologics that we do. We get the right frequency, the right energy, whatnot. Our bodies are capable of doing it. We just have to stimulate the right areas. So more to come, and I'm not saying next year. That could be 10 years, 20 years down the road, but that is the future in my mind.
Obviously, that makes you smile, man. But it makes sense too, though. Like getting our bodies to figure out how to tap into what's already inside of us. It just intuitively makes sense.
Yes.
Doc, look forward to doing a gang more with you, man.
Yeah.
So
No,
appreciate you,
been
man.
my pleasure. So let's keep working. This is wonderful.
Let's do it.